Distinguished experts and esteemed colleagues, I am YunMeng from the Shanghai Changzheng Hospital. It's a great honor to present our team's latest research, titled Quantitative Chemical Exchange Saturation Transfer MRI for Diagnosing Thyroid-Associated Ophthalmopathy Activity, a Prospective Feasibility Study. Our authors declare no conflicts of interest. This study focuses on the staging and assessment of thyroid-associated ophthalmopathy using CEST MRI techniques. TAO is an organ-specific autoimmune biphasic disease, which initiates with active phase and followed by inactive phase. Clinically, the active phase is characterized by inflammation and edema, and is more responsive to hormonal anti-inflammatory drugs, whereas the inactive phase is dominated by fibrosis and fatty infiltration, and undergoes primarily orbital decompression surgery. So, accurate staging of TAO is crucial for selecting the appropriate treatment. Currently, clinical activity score is the most widely used method for assessing the activity of TAO, as recommended by the UGO guidelines and in clinical practice. However, this system primarily relies on symptoms and signs, such as spontaneous orbital pain and pain when looking up and down at the eye. In addition, is heavily influenced by the experience of clinicians. These limitations pose the challenges of reliably evaluating and managing TAO. With advance in orbital imaging, MRI has become a powerful tool to quantitatively assess TAO due to its high soft tissue resolution. CEST is a promising molecular MRI technique for tissue characterization. It measures protein exchange between specific chemical compounds and the bulk water pool. Previous studies have demonstrated that CEST technology based on different saturation frequency offsets can be applied to detect pathological conditions in disease. So, considering the pathological changes in extraocular muscles, we hypothesize that CEST may be useful for staging TAO activity. Therefore, this prospective study evaluates the feasibility of CEST MRI for assessing disease activity in TAO. As for the research methods, we selected a total of 88 patients with active TAO, 76 patients with inactive TAO, and 13 healthy controls based on the inclusion and exclusion criteria for further analysis. Then, we collected clinical data and laboratory parameters from the patients, including baseline characteristics, thyroid hormones, and thyroid antibodies. Subsequently, the T2 stair and CEST MRI sequence were acquired. Two radiologists with 5 and 10 years of head and neck MRI experience manually delineate RI for the bilateral extraocular muscles on the M0 images of CEST. The T2 stair images was used as anatomical reference. The values of MTR, MTR isometrim 1 ppm, MTR isometrim 2 ppm, and MTR isometrim 3.5 ppm for the selected extraocular muscles were extracted separately. Then results. Firstly, regarding CEST MRI parameters of 3 groups comparison, we can see that MTR was significantly higher in inactive TAO than in active TAO. In contrast, MTR isometrim 1 ppm, MTR isometrim 2 ppm, and MTR isometrim 3.5 ppm were significantly higher in active TAO than in inactive TAO. From the correlation analysis, we found that MTR was negatively correlated with case in patients with TAO. In contrast, MTR isometrim 1 ppm, MTR isometrim 2 ppm, and MTR isometrim 3.5 ppm were positively correlated with case. Univariate and multivariate logistic regression analysis showed that MTR and MTR isometrim 1 ppm of extraocular muscles as independent predictors of TAO activity. In the model performance evaluation, we found that the LC for MTR and MTR isometrim 1 ppm in distinguishing active from inactive TAO were 0.722 and 0.730 respectively. Combined MTR and MTR isometrim 1 ppm further improved diagnostic performance, achieving an AUC of 0.805. These are two topical case presentations. The case scores for the selected patients with active and inactive TAO were 4 and 2 respectively. We can see that patients with active TAO exhibit noticeable swelling in the superior and inferior rectus muscles, where no significant swelling was observed in the extraocular muscles of patients with inactive TAO. Taking the inferior rectus muscles of both orbits as an example, the MTR of the bilateral inferior rectus muscles in a patient with inactive TAO was higher than that in a patient with active TAO. MTR isometrim 1 ppm, MTR isometrim 2 ppm, and MTR isometrim 3.5 ppm in patients with active TAO were higher than in patients with inactive TAO. Based on the above analysis, our main findings were that MTR and MTR isometrim 1 ppm were independently associated with TAO activity, and their combination significantly improved diagnostic performance in distinguished active from inactive TAO. MTR and MTR isometrim 1 ppm may serve as quantitative imaging biomarkers to guide treatment decisions in patients with TAO. That brings me to the end of my presentation. Thank you.